Perfect. Great job, folks. We're on it now. Okay, so this is a complicated topic. As I said, I'm going to keep it as simple as possible. I want to start by letting you know that my name is Dr. Roy. I'm a natural medicine doctor, but I'm a fancy kind. You've all heard me say that many times before. That means I have both the conventional medical training and the training in natural therapies. Unfortunately, you guys are seeing me at home right now, which is why it looked like I walked out of a magazine. Just kidding. I live in a 600 square foot apartment, but it's because we don't have power in the clinic. So I'm doing this from home today. And a little bit more about myself. My board specialty is something called integrative oncology. That means I'm a special kind of oncologist. I'm a bridge between conventional medicine, so chemo, radiation, surgery, and natural therapies and nutrition. My job is to prevent the side effects from chemoradiation and optimize outcomes with treatment, which means slow progression of cancer or reduce risk of recurrence. So that means I know a lot about what works, what doesn't, and it's all individual. Okay, if you want to learn a little bit more about me, and for some reason you're in this group and you haven't heard about me, you can take a look at our website, which is in the chat right now. It's AIM Natural, and you can always reach me by email if you have questions. I see my beautiful Sydney is online right now as well. She's usually the person screening those emails. She's on her way to medical school, so she loves to answer your questions. Okay. Let's start talking about cannabis. So you're going to be in a little bit of school here tonight, so try and stay with me. And again, any questions, just pop them up in the chat there, and I'll go ahead and answer them as we go. So I'm going to start by putting up some words on the screen here so I can do some drawing for you. And I wrote them out beforehand because this is a little bit of a word salad and complicated. So I want to make it as simple as possible for you. And that's not what I wanted. So let me do it one more time. Okay. So when we talk, one of the biggest problems with understanding this topic is understanding the terminology. So when we're talking about, oh my goodness, you guys, there goes my doorbell. We're going to ignore it, but it might go off again. When we're talking about a plant, when we're talking about, cannabis sativa, we're talking about the name of the plant. So cannabis sativa is just the name of a type of plant, okay? Try to get all the stigma out of your mind. It's just the name of a plant, picture a plant. There's two strains or daughters, two types of plants. One is a THC type plant, and the other is a CBD type plant. THC just stands for tetrahydrocannabinol. You don't need to know this. And CBD stands for cannabidiol. There's also another one called hemp, but we're going to ignore that for today. Okay. The THC type daughter of this plant is the one when people talk about marijuana, it's the one that we refer to as the marijuana drug. It has psychoactive compounds in it. It does change perception. And it's the one that when people say pot or dope or weed or whatever they're using in colloquially, they mean a plant that came from cannabis sativa that is a THC strain, okay? If we're talking about CBD, CBD has no psychoactive or hallucinogenic effects. It's a completely different strain of that plant. Makes sense to everybody? And I see Patty's video is up. If one more person can put their video up who feels comfortable and just nod at me every once in a while, then I know I'm on track. Otherwise, I'm kind of talking to a dark room. Thank you, Marilyn. I appreciate you. So you just give me a thumbs up or a nod when you understand, or if you don't understand, just let me know, okay? So CBD has more of an anti-anxiety analgesic effect when we're thinking about dividing these just into two broad categories, okay? So there are 3 species of THC. So now we're still just talking about THC. And where's my pen here? Shoot. Let me do this. Whoever just joined, if you could go ahead and mute yourself, my friend. There we go. So there's 3 types of or species of THC. These are when you hear people say words like sativa, indica, or you might have heard of rudalaris, which is a less well-known species of THC. So cannabis sativa, we see up here as the plant, but it's also sometimes referred to as a species of THC. Cannabis sativa or sativa strain has a little bit more CBD in it than THC and is kind of used more for mood disorders. And indica, another strain of THC, has more THC than CBD in it and is used more for sleep. The third strain has very little of either now, or very little THC. It's not important, again, to memorize or to know any of this. What's important is a lot of people have a stigma around CBD and THC use, especially in cancer care, and understanding that when we're talking about CBD, we're not actually talking about a drug that's available on a street level or that's been used to alter consciousness. We're talking about a therapeutic strain or daughter of a plant. And when we're talking about THC, we are talking about a daughter that has been used in a street fashion or in a fashion of altering consciousness, but does have some data in cancer care. Okay, make sense? All right, I'm going to clear my screen here and I'm going to move on from that. And we're going to talk about why these things may work. Okay. So again, a little bit of a word salad here. Try to just stay focused on the major overview and not on trying to understand every little piece, okay? And I'm gonna try and make this bigger just so you guys can see everything I've got on here. So we used to think that there were only a couple of regulatory systems in the body. You guys might have heard of neurotransmitter systems. That's where your brain makes dopamine or serotonin. You might have heard of your endocrine system. For example, your thyroid makes thyroid hormone, which feeds back to the brain to help you regulate fat and sugar. So in other words, there's all these communication systems in the body that help us to regulate body functions. Make sense? Thank you, Marilyn. So we now know of a third or another regulatory system, and that regulatory system is called the endocannabinoid system. It doesn't mean that it has anything to do with cannabis. It just was discovered around the same time that scientists were looking at the impact of cannabis on humans. So it's been around for a while. In other words, you have an endocannabinoid regulatory system in your body, you're born with it. And it's a cell signaling system that helps us to regulate things like sleep, mood, appetite, memory, fertility, reproduction. So your own body is already making endogenous or internal cannabinoids, so compounds that look like the ones that are found in this plant in nature. Isn't that miraculous? And those compounds bind with receptors in your body and help you to regulate these systems. So I'm going to show you a picture of what that might look like, sort of a schematic of what that might look like. So this is a schematic of the endocannabinoid system. So as you can see, let's just take one organ here. Your brain has what are called Cb1 receptors, and we're going to talk about that in just a minute, which means that your brain connects to chemicals that look like cannabinoids, what are made in this plant, cannabis sativa, and those chemicals in your brain, along with neurotransmitters and hormones, help to regulate the body systems. Make sense? Thank you, Marilyn. I so appreciate all those nods. Okay, Barb, you're going to be so far behind. I hate to tell you. It's a very complicated topic, which is why it's great that we're recording it. So I'm just going to check my chat here because I can't. Again, and let's see if that works for you. Yep. Okay. So as I said, your body makes these chemicals that look like cannabinoids to regulate the system. There are two types of them. Again, you don't need to memorize anything at all. All your takeaway is my body knows how to do this and how to use this chemical. The two types are AEA, and you might have heard of an anandamide, or 2AG. And these types of cannabinoids that your body already makes right now, while you're sitting here and I'm talking to you, bind to Cb1 and Cb2 receptors, which we just saw in that schematic. Remember, the brain has mostly Cb1 receptors. So that means that these receptors, or this binds to this receptor, it helps to regulate mood more so than when it binds to these receptors, where it helps to regulate the immune system. Okay? Again, not meant necessary to memorize, just necessary to have a basic understanding. So what is the point of these regulatory systems? Why do we need these regulatory systems? So it's thought that these regulatory systems are necessary in order to help us to maintain homeostasis. Homeostasis means help us to maintain, excuse me, I didn't realize I still had the board up, help us to maintain temperature, an even state, organ functioning, learning and memory, motor control, metabolism, all the things that go into making this factory work, right? It has to be in a steady state at all times. So your body is always sending out these messages to communicate between these different systems already. Okay, let's get back to the plant. So just to catch some people up who came late, we're talking about cannabis sativa, the plant. But that plant has two daughters. Those daughters are THC and CBD. And we are talking right now about both of those daughters. THC has psychoactive compound or components to it, and CBD does not. So THC, if we're taking it, if we're ingesting it, if I'm drinking, eating, smoking it, it binds to Cb1 and Cb2 receptors. So it's pretty powerful, because, and the reason it does that is, again, miraculously, I think it's miraculous just how we were evolved, created, designed, whatever you believe. It mimics the body's internal response system. And so it fits like a lock and key to Cb1 and Cb2 receptors. Now, I forget, you guys are not in medical people, so you may not know what a receptor is. A receptor means, let's talk about ovarian, okay? If this is an ovarian cancer cell, it has a receptor on it, meaning a doorway. Okay. And some ovarian cancer cells do indeed express Cb1, Cb2 doorways. But let's call these a doorway you're familiar with. Let's call it an estrogen doorway or an estrogen receptor. So when estrogen binds to this doorway, let's pretend this triangle is estrogen, it causes this cell to grow. So when chemicals bind to receptors, they tell the cell to do something. Does that make sense? So when we're talking about CB1, CB2 receptors, we're just talking about another kind of receptor, like an estrogen receptor, a progesterone receptor, or HER2/neu receptor. Receptors aren't necessarily bad things or good things. They are how cells receive a signal in order to do what they're supposed to do. That's how the message is conveyed. Okay? Okay. So what we understand then a little bit better now is THC binds to CB1 and CB2 receptors in the body. So going back to our diagram here, it binds to these receptors in the brain, let's say, and it causes the brain cells to do something. And we're going to talk about what it causes them to do in just a minute. With cells like in the bones, for example, that have both CB1 and CB2 receptors, THC binds to both of those, and it causes the bone cells to do something. It's giving it instructions, okay? Now, that's true of all of our regulatory systems in terms of how they work. THC is an active binder to the receptor that causes the cell to do something. CBD does something a little different. And the only reason this matters to you is THC is a little more powerful, CBD is not as powerful. But CBD causes the message not to be broken down fast. Remember Mission Impossible a long time ago? I don't know how old everybody is, when he would get a mission and then it would be like, this mission will destruct in 5 seconds type thing. Thank you, Marilyn. So it's the same thing with cells. You get a signal through the cell, but then that signal quickly goes away. CBD lets that message stay for a little longer, so the cell reads it for a longer period of time. So that means the action may happen over a longer period of time. Make sense to everybody? Okay, good. I don't keep saying that as a verbal tick. I'm saying that to make sure, because it is very complicated. Complicated to me too. I am not an expert in CBD THC. I'm just an expert in all things natural. I keep looking to my right because I'm getting pages from patients, so I may check that occasionally. So coming back to our screen here and what we're learning. So the good thing about THC, and why would you want something that has maybe a little more psychoactive components to it, is because of how it binds. You don't care so much about the psychoactive components. You care about how it works in the body. And because THC mimics the body's endogenous cannabinoids and binds to CB1 and CB2 receptors, it's pretty strong, and it can help with pain in a pretty significant way, and it can help with sleep in a pretty significant way, especially opioid refractive pain, which means a cancer pain that's not responding to a good pain regimen. However, if you're having cancer pain and you don't have a good pain regimen, you should email us. Moving on from that, the con of THC is it does have those psychoactive pieces, so you can feel a little numbed out, anxiety, paranoia. It can just make you feel off, right? CBD, because it's not binding to the receptor and causing the cell to do something, it's simply prolonging the cell's message. Its effects are more modest. It will help with anxiety, so flip of THC, and pain and nausea most significantly, but it may not be effective at all, and it may be a very modest effect. So you can kind of think of CBD as the mommy and THC as the daddy, not to be gender biased here. I know we live in a world where that's super inappropriate, and I need to stop using those genders in my talks. However, I think we're an older crowd, and we can all agree on a kind of a basic understanding here. And it goes even further than that. I don't mean that mommy is less effective than daddy in terms of that punch. I also mean CBD actually tempers THC. So when you combine them together and you have more CBD in the compound and just a little THC, it actually has a much more synergistic effect on the body, because CBD has 100 different faces or 100 different compounds in it that give it more of an entourage effect. So it's like a more gentle holding experience. Does this make sense? Okay, great. Thank you, Marilyn, and thank you, Patty. I'm going to clear this and let's move on from that. And let's talk about, do these fight cancer, right? That's really why everybody's here. Because who cares if we get a little high if we're going to fight cancer, right? I laugh at my own jokes all the time. And often when I do these Zoom talks, I see nobody. So I'm laughing by myself. Okay, no joke though, really seriously, do these fight cancer? So the answer is yes, conclusively in animal and cell studies. So what does that mean? And I'm going to explain that in a second. And what about in humans? Theoretically, yes. So I see there's somebody in the chat. Let me go ahead and see that. Okay, great. So a question from Marilyn. My question will be, there are so many CBDs out there. How do I know which one? That's a great question, Marilyn. I promise I'm going to get to it. We started a little late, so we're going to end just a little late if that's okay with everybody. If people need to jump off, I totally understand. Okay? All right. So bear with me, guys. And if I don't answer your questions, I 100% promise you we will. Qasim's going to pop up that little white slip so that you can ask questions that I don't answer. Okay, do these fight cancer conclusively in animals and cells? So what does that mean? There are 3 levels of evidence in cancer care. The first level of evidence is anecdotal. The second level of evidence is preclinical, and the third is clinical. What does that mean? Anecdotal means my grandmother used this and it worked. Or I talked to a lot of people on my cancer blog and they're saying this worked. Or I'm in a cancer support group and everybody's telling me to try this. It worked. That is anecdotal data. It's not dismissible. It's just not something that we use in oncology. Does that make sense? It is actually powerful because human beings are sharing their human experiences. And when we were ancient peoples and more connected to the earth and more connected to each other, anecdotal data was very powerful, right? Now we're somewhat disconnected. So I don't think it's better or worse that oncology doesn't use anecdotal data. I just think it's important to understand why your oncologist might give you a big, I don't know, when you ask them questions. Does that make sense? How about preclinical? So preclinical is the next level of data. It means that, I'm so sorry, folks, this is a critical patient who I'm monitoring right now. So preclinical data refers to animal and cell studies. So everybody's taking it. Some researcher at a hospital or a university thinks to themselves, I should try this in a mouse line, or I should try this in a little petri dish. So they'll take human ovarian cells, they'll put them in a dish, and they will, these are live human cells that are taken from an ovary, or they're grown to look like an ovary. And they will add this chemical, THC or CBD, to these cells, which they have given cancer to. Thank you, Patty, which they've given cancer to. And and they'll see what happens. That's preclinical data. So when we say, do these things fight cancer? The answer is 100% they do in preclinical data. So there are hundreds and hundreds of studies, mouse studies, human cell line studies that show that when you add THC or CBD to a cancer cell line or to mice that you've given cancer to, it does kill cancer cells. It also blocks blood vessel flow to a tumor, and it also slows progression of that cancer cell's growth. That's why it's gotten this sort of crazy cult reputation, because there's all this preclinical data. And the news organizations and the supplement companies and the blogs and the social media do not have to differentiate between data for you. They don't know the difference, first of all, usually between preclinical and clinical data, and they are not obligated to define that data for you. Does that make sense? But your oncologist and someone like myself only uses clinical data in a cancer setting. Clinical data is, we've tried this in humans. We've taken a group of humans that we don't give it to, a group of humans that we do give it to, and we've seen what happens. Does it fight cancer? The answer is we don't know. Theoretically, when we look at this preclinical data and we understand the science behind the endocannabinoid system, we understand that it should or it could, but there's only been one human clinical trial since 1975 looking at CBD THC to fight cancer. So that is unfortunate. Now, the more pressure you put on the government, which is the organization that does manage trials, particularly the NCCN, the more pressure you put on the NCCN, they have a tab where you can go on there and say what topics are of interest to you, the more motivation there is to look at these things in human trials. Okay? But that doesn't mean they're not useful to you. That does not mean that they're not useful to you. So let me move on from that. What about what we do know about these? What do we know for sure? Okay. So what we know for sure is that, I'm so sorry, you guys. I don't know why people are knocking at my door. I have no friends, but they are. We're just going to ignore it. So what do we know for sure? We do know through human trial or clinical data that THC CBD does in fact treat nausea, cancer-related nausea, cancer-related or chemo-related vomiting, that it does treat pain, cancer-related pain, particularly refractory pain, which we talked about earlier, that it does treat appetite issues, that it does treat sleep, that it does treat anxiety, that it does treat mood disorders, that it does treat GI distress. So there's so many good things that we see that CBD and THC do, that we do have conclusive human data for, which is why we may in our practices recommend it. Now it's tricky in Michigan. Actually, it is illegal for us to recommend it in Michigan. We were and had some problems there. I want to note in the chat, if you click on that link that says HIPAA JOT form, that's a little form. I want to hear from everybody who's here right now. I want to see all 23 of you, with the exception of Patty and Marilyn, so all 21 of you, click on that form and just tell me your name and your email so we can make sure we invite you to our talks. We don't use it for any other purpose or sell it or reach out to you any other way, unless you ask us to. Okay, I do want to show you a couple of trials. So I'm going to go back to my screen here, and I'm going to share with you just what this trial, how strong this trial data is. So if we look at my web browser here, I just pulled up a couple of trials from you guys, for you guys. This is from pubmed.gov. So anytime your natural medicine doctor, who should only be a FABNO, you guys, FABNO, an integrative oncologist, or your oncologist tells you, or your nutritionist tells you to try some sort of natural therapy in cancer, you want to put it in pubmed.gov and see what the data is. So here's some great data. This is a broad study looking at cannabis for management of pain, and it shows that it's conclusively successful. There's no safety issues, no quality issues. And what we found conclusively in these studies that we've established so far is that there's no issues with safety and there's no issues with interaction. So that's really important to note, that they can be used safely over the counter for things that we've talked about: nausea, vomiting, pain, appetite, anxiety. And when we see double-blind, randomized, placebo-controlled, parallel group or phase 2, phase 3 trials, those are very strong trials in cancer centers. When it says multi-center, it means a bunch of cancer centers came together to put that data together for you. So a ton of data. I'm not even going to have time to go through data specifically for you guys. I just want you guys to see how many different effects, clinically evidenced effects there are with CBD THC. Okay, great. Any questions so far? I see a question here. My email address, Bonita. I love that name. It means beautiful in Spanish, Bonita. My father always calls me Bonita. I appreciate you putting your email address on there. You don't have to, though. If you don't want to share it, you can just click on the link right above you. It says HIPAA jot form, and you can put in your email address on there. Okay. Renee asks, does THC hurt the brain? Great question, Renee. It does not hurt the brain. Can you create a dependence of THC? You can, just like you can with any other psychoactive compound. However, when you're getting THC for cancer-related situations, it's combined, remember, with CBD, and CBD, like the mommy, tempers the THC, like the daddies, kind of blunt force effects, so that there's less issues with dependence. Dependence is not the same thing as addiction, Renee. So what I mean by that is, if you indeed have pain, or you're using THC, CBD combinations for, let's say, nausea, vomiting, sleep, insomnia, they're binding to the receptors, and you cannot create an addiction. You can create a dependence. Like, I really feel like I need that to sleep, not if I don't get it, I'm going to go kill somebody. That's an exaggeration, but you know what I mean. Okay. Okay. Great. Renee, if you had another question about that or a follow-up that's more specific, go ahead and put it in the chat. I want to just talk now about, some people have tried CBD and they've said, well, it doesn't work for me. Why is that? Why doesn't it work? So it may not work for you because it is not well regulated. So we don't actually know what formulations people are taking, right? We don't know if they're having, for example, are they using more THC? It could be let's say the combination might look like this: THC, CBD, 5:2, which means 5 parts THC, 2 parts CBD. It might be an oil preparation that you're supposed to administer sublingually, right? So the question is, a lot of pieces, right? Does this tumor that you're trying to work with, does it contain receptors for Cb1, Cb2? Okay, so some tumors really express a ton of receptors, just like some people have more estrogen receptive tumors, right? And some people have less receptive tumors, and these are not things that we're screening for in pathology, so you wouldn't know. Another reason could be variation in bioavailability. When we smoke THC, that's when we get the highest amount of bioavailability, meaning introduction into the tissues in the body. And it's still only like 37%. So when we're eating it, it's more like 5% for CBD and 17% for THC. So we're talking about really low bioavailability there. What if you're not a chubby person? What if you're losing a lot of weight and you're trying to use CBD and THC to kind of stop that wasting syndrome? You may not be able to store it very well because it is stored in the fat tissue. And as I mentioned, oral preparations are not as easy to absorb as inhaled ones, but I don't advise inhaling because, of course, we want to avoid the risk with asthma, COPD, lung issues from radiation, and lung cancer. Okay. Bonita wants to know, what about the hallucinatory effects? Sort of a side effect, I would imagine. So Bonita, I wonder if you joined us a little late. And I'll just repeat a piece of that. And if other people didn't catch this, then put it in the chat, because then I'll know it's something I didn't explain well and Bonita didn't join late. And no criticism, Bonita, not that you did anything wrong. I just hope that I mentioned that, which is that THC does have more of a psychoactive effect than CBD does. CBD has, no psychoactive effect, but THC psychoactive effects doesn't have to be hallucinatory. It's different for each person. It's different, but depending on the preparation, it's different depending on how much THC is in the compound itself. Some people don't have the hallucinatory sensation. Also, as I mentioned earlier, there's several different strains of THC. Two that are well known are sativa and indica strains. Sativa has a different concentration of THC to CBD than indica does. And so that can change things. And to be very frank, Bonita, it depends on the source. The reality is when scientists look at the genetics of what people are actually taking, like the genetics of the plant itself, what they're finding is that most of it actually is different strains of sativa, and it's how people are growing it that changes the flavor or the experience of the plant. Think of it like wine. I'm not a drinker myself, but I hear people talk about this all the time. When they drink a glass of wine, they can tell you about the flavors, the aroma, the meatiness, the fruitiness. It is because of how that grape was grown, how old it was when it was harvested, the type of acidity in the soil, maybe even the love the person put into that plant, whether it was a small grower or an industrial grower, how it was extracted. So CBD and THC, all plants, in order to make a plant medicine, you need to mix it with alcohol or oil to pull the medicine out of the plant. So the solvent can change the nature or the character of that plant. All of those things contribute to the experience you have when you take it. But Bonita, when we're talking right now about THC and CBD, we're not talking about smoking marijuana like you would buy off a friend or you would get in a dispensary. We're talking about using different preparations, and you do have to experiment for different symptoms you may have. Okay? Okay, let me move on from that. And let me try to get to Marilyn's question, which I think is really important, about how do we know, whoops, that's not what I want to show you. How do we know what to take? Okay, so here's the problem. Herein is the problem. The problem is I have no idea how to advise you on quality and source just because of what I just said. I can tell you where our colleagues advise people to go and where we advise people to go. So Charlotte's Web is a great source for CBD and THC because we know this company well. Om of Medicine is a good one, and Blue Sky I've also heard really good things about, but I can't tell you whether or not one is better than the other, or what kinds of preparations they have. And because of the nature of my purview in Michigan, while it has legalized in some ways medical use of marijuana, it is still not legal for me to even advise or recommend it in a supplement. So it's a challenge to be able to really advise you here. However, what I think is really important is to look at the history of the company. With supplements, we can direct you because when we were in medical school, reps came to us and with all their science and all their data, we walked through the factories, we met with their chemical engineers, we looked at their labs, we understood their processes. CBD, THC, it's like this rush to market, right? Everybody's selling it, as Marilyn said. You go to the drugstore, it's there. You go to the gas station, it's there. It's really hard to know what you're getting. So I suggest looking at those three sources. I suggest talking to other people who may be taking THC and CBD who are in your support group, and talking to medical dispensaries. Shop around, find a medical dispensary that you feel good about. There's a couple in Ann Arbor that people speak very highly of. And in our practice, we usually just have a patient advocate that we connect you with who can help direct you so that you're not sort of lost in trying to figure that out. And any contributions people have, go ahead and put that in the chat and we'll talk through them. What about administration? Well, you can take it in many, many different ways. So lollipops, candies, cookies, it can be eaten. One of the things I like to do with dying patients, not that any of you are in that process right now, is to take cannabis, cook it in oil, take that oil and freeze it with a little bit of almond milk, a little bit of maple syrup in ice cube trays. So there's all sorts of different ways to prepare it edibly, to prepare it to eat. There's also sublingual preparations, rectal preparations, like for example, Rick Simpson oil is best taken as a half rice grain rectally to start at bedtime and working your way up. So there's all sorts of different ways to administer THC and CBD. One is not necessarily better than the other. Again, it's about where you're getting it. How did they process it? What do they know about the grower? Those are the things that you want to ask. To be very frank with you guys, most marijuana on the street is actually farmed by cartels in our national forests. And it's a plant. So it's there's heavy use of pesticides and herbicides. So when you're buying something and you don't, my patient says, oh, Dr. Roy, I'm using marijuana, I'll always say, where are you getting it from? And they might say a friend or a friend of a friend. And I'll ask them if they know where that person got it from or if they know the grower. If you know your grower, then you're going to be much safer than if you don't. So if you're working with a dispensary that works with a few growers, or you're working with a dispensary that knows their growers, then you're in better shape. Make sense? Okay. Metabolism, I'm going to skip it. It's too complicated for you guys. I just want you to understand that there are interactions with other natural therapies. So when you're taking natural therapies, they're not benign. They are super powerful. Our patients do very, very well. And that's because we're doing things that are very powerful. We're combining them in a powerful way. But it also means that THC and CBD are using the same doorway in the liver that some of your chemotherapy drugs are, that some of your maintenance prophylactic drugs are, and that some of your natural therapies are. So there can be competition. Usually, if it's for pain, there's no competition with opioids. So you're very safe there. Okay? Okay. And they're synergistic. They won't worsen the effect, the dulling effect of opioids. Oncology professionals are super comfortable with prescribing synthetic cannabinoids, just not telling you to go get medical marijuana. So they will give you drugs like Marinol. Marinol is the exact same thing. It's just made in a lab instead of being harvested from a plant. What's the problem with it? Well, it works, but it's a really heavy high. It's like a sledgehammer high, and it feels to patients like they can barely move when they take it. And it's just unfortunate. It's just because most doctors are just uneducated. I frankly don't use marijuana or alcohol. And as I said, my hands are a little bit tied in terms of recommendations, although of course we work with you. But that doesn't mean it's not my responsibility as a physician to know what we're taking, how it works, how it interacts, to have, tasted it, tried it, used it, and have a real familiarity. And so I think oncology is slow to the game. It's really, really important that we get better educated. Another question here, can there be drug interactions if we're taking pain or anxiety meds? So great question, Marilyn, and I just kind of touched on that. There can be there are no interactions with opioids, and it's synergistic, so it won't increase the side effects of opioids. It'll only help actually modulate it. There are interactions with some anxiety meds. You don't want to take it with, for example, a Zoloft or a Celexa without talking to someone like me. But the problem with your MD, like your psychiatrist or your oncologist, they won't know the pharmacokinetics of how those things interact. Now, I'm not the only Fabno in Michigan. As you guys know, you've probably met with Mike Walker or Jen Green or Shruti March, or there's a new game in town, Andriana Kanda. All of those people are educated in how those things interact. You don't just have to see me. Okay, good question. Last piece here, my DO suggests that I do not take CBD with THC because I have lupus, and I was told that THC damages the brain cells. That is not the case, Renee. So that would be a thing to talk to me about privately, because it's your personal health condition, and I want to make sure that I direct you in the right way. Okay? You're welcome. So I'm going to just post one more thing here, and then I'll open it up for some Q&A. And what I'm going to post here, everybody can see these. I want you to kind of write these down before I get rid of them. Okay, great. What I want to post here is, how do I get it? So when we're talking about medical marijuana, it's a little different from THC CBD because, it's a little different, from CBD. CBD you can buy from the grocery store, but because it has no psychoactive compounds in it. I don't know about the grocery store actually, but you can buy it in very many places. But THC, you need a medical marijuana card in order to legally be using it. Okay, so I don't want you guys to feel like you're doing something wrong. The reality is most people don't go through this process. Most people just use it. They get it from their friends, or they go to a dispensary and they see a doctor there and they get a card. The reality is that that's not the right way to do it. And I like my patients to feel secure and know what they're doing, and how they're doing it legally. So the state does allow you, if you have been diagnosed with cancer, either currently or in the past, or lupus, or a whole host of illnesses, actually, even IBS, they do allow you to get a medical marijuana card. So to do that, you would start an application on michigan.gov/MRA. That's Marijuana Regulatory Agency. Okay. Then you would talk to your oncologist and get approval to use it, which your oncologist is really not going to care usually. If your oncologist is not super friendly, you can talk to your primary care. If you're not comfortable with your oncologist or your primary care, there's always doctors online and at dispensaries that will just approve your application for you. And there's a resource right here at the bottom that helps walk you through that I think is super user friendly. Unfortunately, it's associated with a specific company, but I just loved how user friendly it was. I don't know anything about Pleasant Trees Company. Okay. Okay. Step 3 is you complete your application. It's an online application. It takes 2 weeks to get your card in the mail, and then you're good to go to any medical dispensary and experiment with what you want. Again, some are cleaner than others, some are safer than others, some have a better feel than others. You really do have to kind of experiment and see what works for you, what you like, what feels good to you. I'm going to let you guys write some of those things down. My IT person is letting me know Pleasant Trees is actually in Hamtramck. So do you know, is that a good source for them? I don't know. I don't know that organization, but since he is letting us know he knows them, let's go ahead and post that website on our browser so I can show you how simple this process is, and then we'll open it up for Q&A. So, yep, not yet. He's asking, can he turn your videos back on? And I'm letting him know not yet. Let's just look at this website first, and then we can stop the recording. So can everybody see? No, you can't yet. Can everybody see my browser here? So this is Pleasant Trees. This is the website that I posted up there for you. It says enjoypleasanttrees.com /Michigan -medical -marijuana, and it's marijuana, not marijuana, -card /. I'll put that in the chat, or my IT person, Kasim, will do that. I don't, his name is Kasim, not IT person. So when we look at this, Marilyn laughed at my joke there. Thanks, everybody. When we look at this website here, you can see these are all the conditions that qualify you. And there's a lot, even arthritis or chronic pain, right? Step 1, you Just click on this button. It connects you right to the michigan.gov website. Step 2, you click on this button. You can make an appointment with their doctor, or you can just ask your oncologist to approve your application. Step 3, you would just complete your application online by paying the fee and uploading your driver's license or your voter registration card or Michigan ID card, and then go ahead and head out to a dispensary. So I'm opening it up for questions right now. And Marilyn said they all laughed at my jokes. I appreciate that, Marilyn. Let me put this in the chat so you guys can see it. And you're going to see also that Qasim is going to post that jot form again so that I can meet all 21 of you at least by email. Okay. Any questions? And we're going to stop the recording now. Okay. Oh, Marcia, so you're going to have to stop the recording on your end. And we can either unmute ourselves and just go ahead and turn on your videos and go ahead and tell me your questions, or we can just put them in the chat. And if you don't have any questions, I'm going to end around 5:15. But if you do, we'll go until your questions finish.
If everybody can unmute and put their video back on.
Marcia, do you see where it says stop recording? It's that more button at the bottom. You're still recording, Marcia.